here today with Tajaira Thiessen, or she goes by TJ. She's a nurse practitioner, currently practicing in BC, Vancouver. And so we're just going to talk to her today, ask her a few questions about what a nurse practitioner is and her role, and a couple other things too. So welcome, TJ. And first question we're going to ask you is actually, what is an MP and what do you do?
Yeah, so a nurse practitioner is a nurse that has undergone a 2-year master program. And after the 2-year master program, we can diagnose diseases, we can prescribe medication, and order and interpret diagnostic tests across the lifespan from birth to death.
Awesome.
Yeah.
Okay, so probably one of the most frequent questions that you get is, what is the difference between a nurse practitioner and, say, like an RN, a registered nurse? Mm-hmm. What's the difference in your roles?
Yeah, so all nurse practitioners have to complete the 4-year Bachelor of Science in Nursing program. So by trade, we are still nurses. However, like I said, because we've done those 2 years of a master's program, we are now the ones kind of writing the orders. We're the ones doing specialized tests rather than the nurses who are taking those orders and putting them into action.
Gotcha. So if you're the person who's writing the orders and doing more advanced skills, mm-hmm. what is the difference between you and a physician, like an MD?
Right. So obviously we did not go to med school, so that is a big difference. But it's kind of, we take 2 different paths and land in a kind of similar area. Mm-hmm. The big difference being is that we cannot do surgery and we cannot deliver babies, but we have quite a similar scope of practice that we can do advanced skills, we can prescribe medications and diagnose diseases.
So did you grow up wanting to be a nurse practitioner, or did you know what you wanted to be when you grew up? What was kind of your vision as a child?
So as a child, I wanted to actually be a physician originally, and then through the course of university, I decided to change career direction.
So knowing that you were interested in medicine, what made you decide to pursue a nursing degree over some other type of degree?
Well, I knew that I wanted to be in some sort of medical field. And what my mentality was is if I just did sciences, I did 4 years of sciences, and I unfortunately wasn't going to be able to get into med school. It just wasn't in the cards for me, that I felt like I might not have, a backup plan. So I thought to myself, well, I know I want to be in some sort of medical field, so why don't I do nursing, complete my nursing, apply for med school. If I don't get into med school, then at least I have nursing, and that was something that also very much interested me.
So starting your nursing degree program, you went to UBC Okanagan, and when in your nursing degree did you decide that you were actually going to change direction and become or work towards a nurse practitioner, or was that even in your vision yet at that point?
So I went to a guidance counselor actually the first semester of my first year at nursing, because I wanted to discuss plans to work towards getting into med school. So I sat down with my guidance counselor, told her my vision, and she said, you know what, that's actually quite difficult because the nursing program is so structured and so geared towards becoming a nurse that there's not a lot of leeway for you to take extra courses. She said I'd have to take courses in summer school, I'd have to take probably at least another additional year after my nursing degree to even have the prereqs for med school. And that was a little bit discouraging for me, and I was disappointed. And then she presented the idea of becoming a nurse practitioner and doing a 2 years master's program after my nursing, and that instantly perked my interest.
So as you moved through the rest of your nursing degree, was there anything that either solidified or maybe even de-solidified your choice to pursue a nurse practitioner master's program after you had completed your RN?
I think that it confirmed in me while doing my nursing that I chose the right career path to be in nursing. I loved the opportunity to develop a really close patient-nurse relationship, and that was something that I really loved. So that really confirmed me that yes, nursing was the right choice for me. However, through my practicums in nursing, I really found interest in the autonomy that physicians and nurse practitioners have, that they can actually make clinical decisions, not just kind of an opinion, as unfortunately nursing can provide, which is also very valuable. But I wanted to actually have a stronger voice in my patients' outcomes, and that's why I was, leaning more and more towards pursuing nurse practitioner.
How long after your RN degree did you apply to be a part of the nurse practitioner program?
So I waited for about 3 to 3.5 years after I graduated from my nursing school. Although for most programs you can apply after 2 years, I decided to do 3.5 years.
And what made you wait the extra year and a half? What kind of skills did you acquire in those gap years that you thought were valuable to, I guess, acquire before applying?
Well, I think that after you graduate from nursing school, you're a very novice nurse, and that is after you graduate from anything. You start at the bottom. But in order to be, I think, a successful nurse practitioner, you have to move from that novice nurse to become an expert nurse. You have to be quite confident in your skills. You have to be confident in just your day-to-days of being a nurse. And so I took kind of that extra time to build that expertise, to be an expertise on the floor that I worked, to kind of be a leader, to be a champion of mentoring students, mentoring new graduates, and kind of building those building blocks towards kind of the leadership that you require to be a nurse practitioner. And I also think as well was developing my critical thinking skills as well, which is also very important in being a successful nurse practitioner.
Right. So other than developing perhaps some leadership skills, were there any areas of medicine that you delved into a little bit more in those gap years?
So I did do an emergency and trauma course about a year after I graduated from nursing school, and that actually really solidified a lot of those critical thinking skills, because in emergency you have to be on your feet, and it's very quick thinking. You have people coming in, traumas. You're always thinking, okay, what's the next step, even before the previous step has even happened, because you're just trying to figure out and stabilize that patient. After emergency, I decided to move into cardiology. So I applied and got a job at the cardiac catheterization lab, where it's a multidisciplinary team of x-ray technicians, cardiac technicians, doctors and nurses, and we all work together and kind of open the coronary arteries in your heart after people have heart attacks. So I kind of moved into that role, kind of more specialized in cardiology, and then also took on leadership and mentorship roles there.
Wow. And did you pursue any, I guess, extracurriculars in addition to your work experience, like any volunteer or other job shadowing experience that you took on in those gap years to kind of set yourself above and beyond perhaps other applicants?
Yeah, I was always interested in humanitarian work. It's always something that has interested me. And so I thought, how can I marry my passion for humanitarian work and my love of medicine? And so I actually did a couple medical humanitarian trips, one in Uganda, one in Nepal, and one in India. And those just really proved to me how much I can just marry two passions together.
Was there any specific pathologies that you were acquainted with when working overseas that perhaps you wouldn't maybe see a whole lot here? Or what were some of the roles that you did on your medical missions trips?
Yeah, so probably the most common pathology was malaria. We saw a lot there. And speaking specifically to Uganda, that was my most recent trip. We did a lot of education. So we went and even taught at a school how kids should brush their teeth, which seems super common here, but kids, were using sticks to brush their teeth. So bringing, toothbrushes to each of the students, educating them there. We did a lot of baby immunizations. So we go out to other local towns and immunize babies as per the immunization schedule, weigh them, and then, as per the immunization schedule, a month down the line, they would continue in those towns.
So applying to a master's program, that seems a little bit intense and maybe a little bit scary. What was the application like? Did they require you to do certain things? Was there an interview component? How did it look?
So it was twofold. The first step was the online application, which they required 2 essays to be written, and then you had to provide 3 references. So that's what you would send off first, as well as your grades, which are also very important. And then if you got accepted from there, they did interviews, and so that was a panel interview.
Wow. So I'm going to ask you a bit about your master's program itself. Was it course or thesis based that you did?
So the Masters of Nursing Nurse Practitioner is course-based.
Okay. Yeah. Is there a thesis-based program that is for a Masters of Nursing?
So there is a thesis-based. That, however, will not get you to become a nurse practitioner. That is more guided towards research, if you want to be a clinical nurse educator, if you kind of want to move up in regards to just nursing in a hospital setting.
Does your master's program offer certain types of rotations similarly to residencies in med school?
So we do something called practicums, which are similar to rotations. However, because we're like a family-based program, you have to do a minimum of 2 family practice practicums. So that would be in, a family physician office. And then you could also then expand afterwards to other areas that might interest you or areas that are available.
Okay. You do have a little bit of a say as to where you get to do some of your rotations?
Correct. Yeah. Depending on what your area of interest might be.
Okay. So in order to graduate with your master's in nurse practitioner, was there anything that you had to specifically accomplish? Any board certification exams, things like that you had to complete?
So there were a couple things we had to do. The first being we had a project that we had to complete, and that was in order to graduate from the university. So that was something called a culminating project, which is a very lengthy paper that we have to do. And then in addition to that, a project, whether that be create a website or create a 1-page primer or a book. And that's what you have to complete in order to graduate the university program. And in order to be board certified by the province, you have to complete 2 things. One is a written exam, and the second is a practical exam.
Okay. So physicians who have completed their residencies, they have the opportunity to specialize further by doing a fellowship. Do nurse practitioners have that kind of opportunity? Do you complete specializations in certain areas, or how does it look for NPs?
So we can, what you would say, specialize, but it's not like I would then be, if I was in cardiac, I would then be a cardiologist. What we can do is we do kind of like longer orientations. So for example, because I was in cardiology, I did a 3 to 4 month orientation where I went and watched the surgeries with the surgeons. I collaborated with the surgeons, the physicians, the nurse practitioners in cardiology. I'd go down and learn how to interpret, echocardiograms and ECGs, stuff that was very specific to cardiology. But by definition, it's not a fellowship.
Okay. Do you have any goals that you're working towards right now as a nurse practitioner?
I definitely have a few. I was very lucky right out of my nurse practitioner program that I was able to land a dream job of mine, which is working in cardiology. But I still have a few goals, which are going to be very long-standing, probably goals I'll have, throughout my whole nurse practitioner career. One is just to educate people about what a nurse practitioner is, what we do, and just to be recognized because we are a fairly new profession. I think that we have such an amazing job where we've been able to marry nursing and the biomedical model together, and we were able to kind of have our toes in each, in nursing and in medicine, and I think that that's a really cool opportunity, and I think that it's great to be able to educate people on that. And second of all, I want to utilize my nurse practitioner scope of practice and bring that into humanitarian medical work abroad. I think that has such a great opportunity to now be able to diagnose diseases and prescribe medications in countries where they maybe don't have as many physicians or nurse practitioners available to do that.
Right. Wow. What would you say is the favorite component of your job as a nurse practitioner?
What I enjoy the most is working within a multidisciplinary team. I love the fact that I get to run with the nurses and listen to the insight that they have with the patients because they know them so well, and have discussions about the patient and kind of what our plan of care is, and then also discussing with the physicians and the surgeons who completed the surgeries, and they have this wealth of knowledge, while also working with the social workers, our pharmacist, physiotherapy, and occupational therapy all together, and just really coming and looking at the patient in a holistic manner all together as a team. That's something I really value.
So it sounds like this is a very interactive job where you're working with a lot of other healthcare professionals, and you're working with the nurses, and then you also have your patient nurse practitioner interaction. So are there certain skills that you would say would be advantageous in order to become a nurse practitioner?
I think there are. I think that each of these you can grow into, and you will continue to grow as your nurse practitioner in any role. One being leadership. I don't think you need to have these strong leaderships to begin with, but you have to be okay with being in a leadership role because you are interacting with patients, and patients see you as this, physician, nurse practitioner who knows a lot of stuff, and being able to be honest and open with them and having a dialogue and being confident in your decision-making processes, as well as being a leader just on the floor, being collaborative with the nurses, but also ultimately you are the one making those decisions. So I think leadership is a really important one. I think second of all is just collaboration, because you work with such a huge multidisciplinary team. And thirdly, I think just knowing and enjoying learning, constantly learning, adapting. Medicine is constantly changing, and just that desire to learn and grow to make you a better nurse practitioner, and to really just ultimately have the best knowledge so you can care for your patients in the best way possible.
Where do you find nurse practitioners working, and what is their scope of practice in the areas that they're working?
So nurse practitioners, similar to physicians, can work almost anywhere, except, like I said, they can't deliver babies and can't do surgery. So a lot of my colleagues work in primary care, so they act or are similar to a family physician, where they have their own patient load, they have their own patients that they see on a regular basis. I have colleagues that work in post-operative orthopedics or vascular, ICU, emergency, women's health. So nurse practitioners have the same opportunities, or very similar opportunities, as physicians, and depending on where you work will depend on your expansive scope of practice. So you will have additional opportunities to provide more advanced skills depending on where you work.
Awesome. I just want to ask you if you can just kind of portray to us what an average day in the life of a nurse practitioner looks like working on the cardiology floor that you do.
Absolutely. So in the morning, the nurses are all kind of getting acquainted with their patients. So I'm in the back looking at lab results. I'm looking at previous labs or x-rays from the day before, and kind of collecting my thoughts and preparing for the day. Obviously in the morning, if there are already issues on the floor with patients, I am going and seeing those patients immediately. So that's kind of a little bit of a flex time for about an hour. And then we do a multidisciplinary collaborative rounds where the nurses report on each patient, kind of informing us what's been going on throughout the night and kind of what our plan and outcome goals are for the day. And then I start rounding on the patients on the floor. So I always see kind of my sickest patients first, kind of the patients that need care, need a direct plan right now. And then once I've kind of seen those patients, I will round on patients that I need to send home that day, because we're a post-operative surgery floor. We usually send patients home day 5. And then I will see the remaining of the patients that are going to be sticking around for the next couple days. And that kind of takes the rest of the day up. If I do have any remaining time in the evening, I'm either preparing for the next day, or you're always kind of checking on patients, checking on lab work, seeing patients that maybe a new issue has arrived that didn't originally or wasn't present in the morning.
Okay, awesome. I think I have one other question. Just everybody kind of likes to know of how much their actual career maybe seeps into their extracurricular time. And so I wonder if you could maybe explain if you find that when you leave work, you're done work, or if your work sometimes, you get calls in the evening, or if there's anything that you feel that you kind of get burdened by your job outside of work.
I think I can only speak to my personal experience. I know that some nurse practitioners are on call, so they do get called above and beyond their set hours that they're either in their clinic or they're at the hospital. I don't do on-call hours, so kind of once I leave the hospital, I usually don't get called unless they very specifically tell the nurses to give me a call once blood work is back. But that usually doesn't happen because we have our surgeons that are on call throughout the rest of the evening. And then we are on a rotating schedule. So specifically where I work anywhere, 7 days a week in rotating schedule. However, some nurse practitioners might only work Monday to Friday. It's a little bit different, but I don't know any nurse practitioners that work night shifts.
Okay. So going back to your first year of undergraduate school, where you actually discovered the role of an NP, and now accomplishing that goal of actually becoming a nurse practitioner. Do you feel happy with your decision to pursue it? Are you content with where you're at? Do you feel like it met your expectations?
Yeah, I love being a nurse practitioner. I think the fact that I get to marry my nursing skills and my patient nurse relationships and that trusting, very holistic approach that nurses learn, get to marry that with my love and passion of medicine, and bringing those two together has just brought me so much joy that I can really gift that to each patient. You know, taking the time and being intentional in having a very personal discussion with my patients and really seeing them for who they are and seeing them through multiple lenses and kind of meeting them where they're at, while also having this biomedical model in the back of my mind and being able to think very critically and analyzing, you know, their diagnosis or their disease in a more, you know, streamlined approach. I think that is very valuable, and I love the opportunity that I get to do both of them together in one job.
Awesome. Well, this has been a really cool privilege to have you talk about your job and some of the inner workings of it. So we want to say thank you for having TJ here today to talk about it. And if you guys have any questions, you can redirect them to me and I'll pass them along to her and we'll get some answers for you. But thanks so much, TJ.
Very welcome. Thank you.